We'll start the second part of pathogen group number 10 here with human papilloma viruses, HPVs. They cause genital warts and cervical cancer. There are two types of human papilloma viruses. Those that are epidermotrophic, they cause warts on the skin, and then we have mucosa-trophic ones, they cause anogenital warts, oral and throat lesions. There are over 100 human papillomaviruses around. About 30 of them are sexually transmitted, and making it one of the most prevalent sexually transmitted infections in the United States. STI stands for sexually transmitted infection. So here are some nasty pictures of human papillomaviruses causing genital warts and cervical cancer. So the virus here is a double-stranded DNA virus, no envelope. Most of the cervical cancers are associated with only two strains, and there would be strains 16 and 18, and they cause over 90% of the cases of cervical cancer. And so nowadays you have a vaccine available that is actually aimed against those particular strains. It's called the Gardasil shot, Gardasil. And it is a vaccination that will give you immunity against the human papilloma viruses, the most important strains that are causing the vast majority of these cervical cancers. The shot is recommended for both women and men, actually for teenagers of either sex. And the reason for vaccinating boys is that then they will not be able to transmit the disease to girls. Okay, so here will be some genital warts. I don't know if somebody has a penis like that. I'm not sure. They should be doing something about it. But anyway, let's move on. So here we have HIV AIDS. This will be our last pathogen to recover. And we also had some lecture information on that. I'm not sure if you got a chance to take a look at the lecture material. That was on the chapter of the diseases associated with the immune system. So here's sort of the similar information that we already covered in lectures. I'm going to do this pretty quickly here. In the United States, the earliest cases were in the early 1980s. It was probably much earlier around and if you look at the lecture, you will see some information on that. About 1 million estimated HIV positive cases in the United States now, and it's been stable at this 1 million number for at least a decade or so. The virus may have originated around 1930s. There are some different theories out there. It probably was a monkey virus that was zoonotic and then jumped to humans and started infecting humans. It could have been a mutation of the SIV, the simian immunodeficiency virus, but this was it's definitely a pandemic. And you have in the lecture information, I had some geographic information. Most of the cases are still in sub-Saharan Africa, but it's worldwide. You have associated about 3 million deaths per year worldwide. 42 million people living there in the world that are HIV positive, and it's no longer just a disease of homosexual males. That's what a lot of people were thinking at first, but it's 50-50 male and female. And we are going to take a look at the profile here. So HIV, the name of the virus is human immunodeficiency virus, abbreviated HIV. There are two versions of this virus, HIV-1, which is much more common, and then HIV-2, which is rare. So HIV-1 and HIV-2. The name of the disease, it causes AIDS, and so a lot of people also call it AIDS virus, although the official name is the scientific name is human immunodeficiency virus. The genetic material is single-stranded RNA. It is a retrovirus. Once in the host cell, it changes the RNA back to DNA using the reverse transcriptase enzyme that it has packaged within the virus. And then the DNA that's generated from the viral RNA is incorporated into the host cell genome. This virus does have an envelope. And Here's what it looks like. Here's HIV. You have the RNA in the core right here. I should follow the squiggle lines right here. And then we have the reverse transcriptase enzyme that it needs to convert the viral RNA back into DNA. It comes packaged with the virus, conveniently packaged. And then here you have the spike proteins, the GP120 and the GP40. Those are used to latch on to helper T cells, the CD4 plus cells. So here is how HIV gets in. HIV will basically latch on with the GP120 protein onto the CD4 plus receptor on T helper cells, and then it will get its genetic material, the RNA, will go into the cell. Reverse transcriptase, this enzyme, will convert the RNA back to DNA, and then the DNA gets incorporated into the host cell genome. So there are some related viruses around. There you can take a look at the distinguishing features. It's usually the spike proteins that are different, and the type of reverse transcriptase. But let's take a look at how an HIV infects a T cell. So we have to latch on to the CD4 receptor found on helper T cells, and that is the GP120 protein. It will latch on to the CD4 receptor on helper T cells, and then it will inject its viral RNA into the cell, and then reverse transcriptase will take care of making DNA from that. So here, once the virus has reprogrammed the cell that it infected, now here's the viral DNA now, and now we can make the viral proteins, the code proteins, make more viral RNA, and then we need to assemble the whole thing. So this is a big step. The viral particles, they need to be assembled, and then once we have complete viral particles, they will bud off the host cell like this. They're taking a patch of the phospholipid bilayer with themselves as they're budding off of the host cell. So here's a kind of famous picture, HIV in blue, these little blue particles, you can see them right here. They're leaving the host cell, budding off of the host cell. Okay, so here will be the typical kind of progression of HIV infection by looking at the helper T cell decline in blood, and that's a very similar graph to what we had for the lecture slides. So here, initially, the initial infection, you have a very high viral load, so that means your viral concentration spikes from the get-go right there. And here the timeline is in years. So after a couple months, you have antibodies then in your blood, but HIV keeps hiding in your helper T cells. And so basically starting then, your immune system will produce antibodies, but still most people will have a steady decline of their helper T cell population. So the CD4 plus T cells, they will be having a steady decline. And as soon as you're reaching this critical value of 200 helper T cells per microliter of blood, this is when you're going to have full-blown AIDS. And depending on the status of your immune system, it can take only a year to reach this point. It can be, nowadays with medications, you can stay in this pre-AIDS state. You can stay there indefinitely, and you will probably never have AIDS. So initially, it was thought that the average time it will take to reach that time to full-blown AIDS, so this 200 CD4 plus cell marker, it would take on average about 10 years. It was always faster for children, and if you're a healthy adult, it was a little bit longer, but it was thought that reaching that stage is inevitable. Nowadays, with medications, you can prevent ever reaching this landmark of 200 helper T cells per microliter of blood. Now let's take a look at the pathogenic properties of HIV. The big problem is that it destroys helper T cells, and helper T cells are necessary to activate other parts of your immune system. If you destroy the helper T cells, then your immune functions will not be activated. And that means you're impairing both humoral and cell-mediated immune functions. That means you're not making antibodies anymore, and you're not calling out cytotoxic T cells and what other T cells. You also may destroy some neurons, but the main problem with HIV infection is that it destroys a critical cell that mediates the activation of other parts of your immune functions. And so basically you have your immune system in place, but it's not being activated. Let's move on to high-risk individuals, especially if you're sharing needles, injection equipment. People with many sex partners that are promiscuous are definitely at higher risk. People with occupational exposure to blood products, needle pricks, accidental needle pricks, people who receive blood or blood products, that risk has been pretty much eliminated because all these blood donations are always being tested. And if you are born to an HIV positive woman, the infant has a pretty high chance of also being HIV infected. And of course, if you're the sex partner of one of these high-risk people, then you also have a higher risk. The reservoir for HIV is apparently only humans. The parts of the body infected, these helper T cells, that's the really bad news. Helper T cells, you need them to activate all sorts of immune functions, and if they're not there, then your immune system is just not going to be called out to help fight infections. Also, macrophages and neurons can be infected. The transmission can be transplacental through blood or blood products. And then the most common transmission is through sex, and anal, vaginal, oral, any type of sex. So this kind of close contact with body fluids, that will be definitely a way of transmission. And then breastfeeding, although breastfeeding is not one of the main routes here of infection. The port of entry is typically through very close contact with body fluids, and so it would have to be direct, most usually mucous membranes, direct contact with mucous membranes. The incubation period, it depends a little bit, and I have another slide that explains that better. The period of illness is chronic, and the contagious period, we'll take a look at that on this next chart anyway. So, and the symptoms also, that was also covered in the lecture slides, but let's take a look at the HIV disease cycle. So here you can see the acute phase. So first you have a high viral load. It will take you quite a bit of time before you have antibodies that are measurable. So the antibodies here on the green line, it takes quite some time. And after an acute phase, where you may have some flu-like symptoms, you're not feeling good, but you wouldn't suspect that necessarily to be HIV, you're going to have a fairly long asymptomatic phase. And at that time, you have the steady decline of your helper T cell population if you don't do anything about. Now, you can detect the virus, and you can also detect the antibodies during that time. But you are pretty much asymptomatic. And once you reach that critical level of 200 helper T cells or less per microliter of blood, that's when you're going to have all these opportunistic infections that are popping up. So as your T cell population is on a steady decline, the most serious complications then would be AIDS, the acquired immunodeficiency syndrome, where you're going to end up dying from opportunistic pathogens. It could be something as simple as a yeast infection that could end up killing you. A lot of people also end up with cancers, and that is because the lowered immune function allows the cancer to develop. One of the hallmarks of HIV infection is Kaposi Sarcoma, and that's what I wanted to show you here. That's a sort of a deep tissue cancer that is almost only seen in HIV patients. So sort of a hallmark, almost a diagnostic feature of HIV infection. Now let's take a look at diagnostic methods. Most HIV tests, they will look for the antibodies against HIV, not the antigen. You can use ELISA test or Western blot to look for the antibodies, but you have to keep in mind that it takes some time for people to show a positive on these tests, because it takes several months, sometimes up to a year, before people convert to positive with the antibody tests. Here on HIV prevention, I'm sure you have heard some of this. You should minimize the number of different sex partners, use condoms, avoid casual and anal sex. On the blood route, do not share needles or anything else that penetrates the skin, and test any blood and blood products before they are being used for patients. Now, the status of an HIV vaccine, there's nothing to report because it's still not available. And the status of HIV treatment, we're using a combination of everything available, and there would be all of these included here.